So with the current pandemic of COVID-19, there have been some changes to resuscitation protocols. So typically we would be coming into the room, checking for dangers with every job, assessing for level of consciousness, and then very shortly in we'd be checking for breathing, see if they're breathing or ineffective breathing or absent of breathing. By doing this, we'd be placing one hand on the forehead, fingers under the chin, and we would typically be getting our cheek very close to the patient's mouth, looking down to the abdomen to see if it's rising. We'll be listening for breathing and also feeling for breath on our cheeks. The risk here is if the patient is COVID positive, you are placing yourself at risk of catching COVID. So the current guidelines now are to ideally cover the patient's face. I've got a triangular bandage here, but items of clothing or even a face mask, you can pop that on your patient. And then when we're going to be assessing for breathing, we're just going to be standing back and looking to see if there's any signs of indications of breathing with chest rise and fall. If you don't believe your patient is breathing or breathing adequately, make sure you've called for the emergency services. You've also made sure you've got someone to go and get the AED machine, and we're going to commence CPR, and that is performed in the same ways prior to COVID. One hand, centre of the chest, other hand on top, in nice and close, shoulders locked, over the top, and pushing down 1/3 of the patient's depth at a rate of 110 beats.